Hello dear colleagues and MRCP aspirants. Today I'm just going to discuss Myotonia dystrophica, and especially during this video clip I'm going to highlight when to do screening for Myotonia dystrophica. As we know, Myotonia dystrophica or myotonic dystrophy is a genetic disorder, and it is caused by mutation in the DMPK gene, that is for myotonic dystrophy type 1, or it could be because of CNBP gene mutation, that is for Myotonia dystrophica type 2. So these are the two types of Myotonia dystrophica, and both are having the different type of gene mutation, and both are autosomal dominant disorders. Now the question arises, should we do screening to diagnose Myotonia dystrophica at an earlier stage or no? As we are doing the screening for autosomal dominant polycystic kidney disease and other genetic disorders. So the recommendation is, it is not routinely done. The screening for Myotonia dystrophica is not typically recommended, but it is recommended in specific situations. It is not for general population screening. So today I want to highlight what are the specific scenarios or the condition where the screening for Myotonia dystrophica is recommended. So there are 6 recommendations or the 6 conditions that I will highlight one by one. So number 1 is positive family history. If someone is known family history of Myotonia dystrophica, genetic counseling and testing are recommended for at-risk relatives. So if there is family history positive, then the genetic testing, genetic counseling and testing is often recommended. Number 2, the symptoms. If the individual is presenting with symptoms such as muscle weakness, myotonia features like the delayed muscle relaxation, and they have got the other features of myotonia like cataract or cardiac conduction defect or the systemic manifestation of Myotonia dystrophica, then they should be evaluated and tested. Number 3rd condition where we can do screening for Myotonia dystrophica is prenatal screening. If one of the parent is known to carry the mutation, prenatal testing, for example the chorionic villus sampling or the amniocentesis, can be offered to determine if the fetus has inherited the condition or no. Number 4th indication for screening is pre-implantation genetic diagnosis. It is recommended, this is pre-implantation, so it is recommended for couples where one or both parents carry the mutation. In that condition, the pre-implantation genetic diagnosis can be used, and we have to select like this healthy sperm and the healthy ova, and then we have to go for fertilization outside the womb and outside the uterus. So after selecting the healthy ova and the sperm, and after doing the fertilization, we can select the embryos that will be free for the disease of Myotonia dystrophica. So this is the 4th recommendation for screening. The 5th screening is, if the screening is not done during the perinatal period or before the implantation. But the newborn screening, this is the fifth indication, the newborn screening. Currently, myotonic dystrophy is not typically included in routine newborn screening panels, but this can be considered in families with a known history of this condition. And the last and sixth one indication for screening is early diagnosis in children. In cases where children exhibit developmental delays, muscle weakness, or other symptoms suggestive of congenital myotonic dystrophy, then the genetic testing is indicated. So these are the six conditions or the six indications for screening of myotonia dystrophica. Again, I want to highlight that myotonia dystrophica is not a disease where we should go for routine screening as we are doing in other genetic condition. It is not recommended. If someone is considering to screen for myotonia dystrophica, it is advisable that he or she should consult the healthcare provider. Then the healthcare provider will refer the patient, the person, to the genetic counselor. The genetic counselor will give them briefing about the risks, benefits, and implication of testing. Because once the person is diagnosed with myotonia dystrophica, there are risks and there are benefits. Like the risk could be if it is diagnosed, so if the couples they don't know about the status of each other, if someone is diagnosed, so it can cause separation. It can cause other effects like the depression and like the psychological effects if someone diagnosed with myotonia dystrophica. So there are multiple risks. So the benefits could be like early diagnosis makes the person do something to control the symptoms and to control the progression of the disease. So these are the benefits. So this is the duty of genetic counselor. He will see and he will assess what are the benefits and the risk associated with every case. So the routine screening for myotonia dystrophica is not recommended as per guidelines. And now the question arises, why the routine screening is not recommended for myotonia dystrophica? And there are different good reasons for that. So I will highlight what are the several reasons that is considered. So because of these reasons, the screening for myotonia dystrophica is not recommended in guideline. Number one is low prevalence. Myotonia dystrophica is relatively a rare disease, with type 1 being more common than the type 2. The low prevalence means that the likelihood of finding asymptomatic cases in the general population is low. It makes the widespread screening inefficient and not cost effective. So this is one of the reasons. The second reason for not recommending routinely is genetic counseling and testing is complex phenomena. It requires proper genetic counseling before and after the testing. This is because the implication of a positive test results can be significantly affecting not only the individuals but also the family members. So, routine screening without a clear medical indication or without a positive family history could lead to unnecessary anxiety and complex decision making for individuals and for the families. The third reason is ethical consideration. There are ethical concerns related to genetic testing, including privacy, the potential for genetic discrimination by the employers, job effect can be job can be affected, insurance issues can rise, and the psychological impact if someone is becoming positive by the screening but he or she is still not having any symptoms. So it will cause impact of knowing one's genetic status, especially for a condition with a variable expression of the disease, variable expression of the symptoms and the disease progression. And the important thing is there is no cure for the disease. The next reason is variable expression and penetrance. Myotonia dystrophica has wide range of symptoms and severity, and some individuals may be minimally affected or may remain asymptomatic. This variability makes it difficult to predict the impact of the disease on an individual's life, complicating the decision-making process for those who might consider screening. The next reason is lack of early intervention. Currently, as we know, there is no curative treatment for Myotonia dystrophica, and the treatment is primarily supportive and symptomatic. Early detection through the routine screening does not lead to interventions that can alter the course of the disease, although it may help in managing symptoms and planning for the future. So, the targeted screening is recommended for individuals with a family history of Myotonia dystrophica or those showing symptoms suggestive of this condition. This approach is more efficient and allows us for appropriate genetic counseling and support. So in summary, routine screening for Myotonia dystrophica is not recommended due to disease low prevalence, the complexity of the genetic testing, ethical consideration, variable disease expression in different patients, lack of curative treatment, and the availability of more targeted screening approaches for at-risk individuals. So this is all about the questions why the routine screening for Myotonia dystrophica is not recommended till now. This is part one recording for Myotonia dystrophica. Please see the part 2 for Myotonia dystrophica, where we discussed about Myotonia dystrophica, how it presents, what are the signs and symptoms, and what could be the examination findings, and how to investigate the patient, and how to manage the patient in details. So please follow with the second part of Myotonia dystrophica. Thank you very much for joining us, and it is recommended please join our YouTube channel and join PACES Pulse Academy WhatsApp group, so you will remain in touch with our frequent sessions and our courses. Thank you so much.
For more detailed explanations and related topics, we invite you to watch our videos on our YouTube channel. Don't forget to like, comment, and subscribe to stay updated with our latest educational content. Thank you.